So this is my bedroom. I just got it redecorated for my 16th birthday.
It kind of started around about the beginning of March when I had a call from school.
And one of the favourite parts of it is probably my wardrobe. So I've got all the memories, things like me and my friends, things I'm interested in.
So all of a sudden, Lila just suddenly stopped eating. You know, she was clearly counting calories.
And then a majority of the photos in there sort of come from a Polaroid camera.
It seemed to spiral really quite quickly, and it was horrific. It was frightening.
Lila has struggled with her mental health for a decade, but during the pandemic, it's got worse, and now she regularly harms herself.
Self-harm served as a real sort of a release to me. I would, if I had a bad day at school or just a tough time, if I was going through something, I just felt very overwhelmed. I definitely did get addicted to self-harm. But I look back on it now, and I definitely do regret it.
From being referred for help to receiving treatment took 4 months, and all the while Lila was getting worse.
You can see things kind of progressively kind of spiralling. So yeah, and you were almost at crisis point by the time you kind of got that initial appointment in.
Hello, it's lovely to see you.
Hiya.
Yeah, hi. How are you doing? All right.
Lila's eating disorder, self-harm and suicidal thoughts have put her in serious risk. She's getting support from Children and Adolescent Mental Health Services, or CAMS for short.
It was just like trying to replace the thoughts, but it wasn't effective.
This is a busy part of the NHS, and as children try to cope with the impact of the pandemic, it's getting busier.
So over the past couple of months, she's had a lot of life stresses. So
can you give me a phone call back, please?
There is one case more pressing than probably any of the others.
This CAMS team at Pennine Care NHS Trust is rated as excellent by the Care Quality Commission. But like many others, it's understaffed. Nationally, just 1% of all NHS funding goes to CAMS.
So it was just to let you know that we've come to an outcome of that, and that it is that you've got the diagnosis of autism. I was going to explain it a little bit to you.
Charlotte's a mental health nurse, and she's busy. They're a member of staff down here, and that means more patients have to wait to be seen.
It makes you feel that you can't do your job properly. You can't do the job how you set out at the beginning to do it. It feels like a big barrier. You've got children coming in who they want to kill themselves. You've got children coming in who are self-harming. So that's stressful on its own. But then to add into the mix staffing issues, lack of resources, and it feels like overwhelming. It feels overwhelming.
Thousands of children are waiting longer than they should because CAMS is under pressure. In 2020, nearly 31,000 children were referred to CAMS. 38% of those children had to wait more than the 18-week NHS target to get their first assessment. And 34% of those who were accepted had to wait more than 18 weeks to start treatment. 617 had to wait more than a year for treatment.
When you're at crisis point, it is there and everything kicks in, but you shouldn't have to get to crisis point to be able to receive that service.
Yeah, it's such like a unimaginable concept that in order to get better and recover, you have to hit the bottom and you have to get worse.
The government says it wants to invest £79 million into mental health services for children and young people. But the Royal College of Psychiatrists say that figure should be closer to £500 million.
So for the people who are in crisis and who absolutely need us right now, there is not a wait. But for the people who have less of a crisis presentation, their wait is long, and it's absolutely heartbreaking to know that.
Even with the wait, Lila is one of the lucky ones. She's now being seen. But for too many families, the path to treatment is a long one. Nick Martin, Sky News.